Hello and welcome to Niaga Spotlight with me, Tamina Kausji. Niaga Spotlight takes us through the week in economic analysis and future affairs. Now this week on Future Affairs, we are spotlighting the cost of eating, affordability versus nutrition. Now, rising food taxes and living costs are reshaping what and how Malaysian families eat. Since the 1st of July, the new expanded 5% SST now also applies to staples like fruits, fish, legumes, dairy and cooking oil, which also bites into already tight B40 and also M40 budgets. Now this week also, Prime Minister Anwar Ibrahim announced Malaysia's first ever universal 100 ringgit cash aid per adult, disbursed from the 31st of August to the 31st of December 2025, redeemable at over 4,100 outlets, including Maidan, Lotuses, EconSave, as well as selected sundry shops across districts nationwide. Now meanwhile, the World Health Organization, the WHO, ranks Malaysia as having one of the highest childhood obesity rates in Southeast Asia, with the prevalence of childhood overweight, obesity and excess weight in Malaysia almost doubling over a 26-year period from 1996 to 2022. A dual burden of too much as well as too little food, with nutrition being a key concern. So joining me to explore how policy, price and plate intersects today is Dr. Salini Devi Rajendran, Senior Lecturer with the Taylor's Culinary Institute at Taylor's University. We dig into this very interesting conversation at this very timely moment. A very good morning, Dr. Salini. How are you doing today? Good morning.
Thank you. So I'm fine, and thank you for inviting me for this very timely topic.
Yes, absolutely. So, Dr. Salini, as a culinary academic, the work that you do, of course, intersects very interestingly with all of these issues all at once, also, of course, in your capacity as a lecturer. So how do you then reconcile the 5% introduction of SST on staples? Of course, there have been exceptions, but quite broadly, it also impacts fruits, legumes, fish, dairy, and all of these are nutritious food choices. And at the same time, Malaysia also has rising non-communicable disease, those NCD rates. Your thoughts on this?
Right. As a culinary academic, and we work very closely with three major components. That's food, health, and policy. And we look these three major components intersect each and another.
That's right.
So with this 5% of SST expansion, it's quite worrying, and it's considered as a serious concern, and not just from the economically standpoint, but also the public health. What happened with these low-income families or households, especially the B40s? They are among the most affected with the high living costs, limited income, where they are juggling between the family responsibility. They have to work additional, like 2 to 3 jobs to support the family. This is where the gap happens.
Exactly.
This creates a gap between what is affordable and what's nutrition.
Correct. And I think another interesting data point that we have most recently is that Malaysia actually carries the highest grocery bill across Southeast Asian countries, coming up to, on average, 9,000 ringgit per household per year, while wages are also remaining fairly stagnant. So to follow up on that, Dr. Salini, so at the same time, given that most adults in Malaysia still consume fewer than our recommended 5 servings of fruits and vegetables daily, how do we then not only shift behavior, but an overall system, which of course means those from underserved communities already have less time and also less money for nutritious food purchases?
That's absolutely true, because studies already claim and prove that Malaysians do not eat the recommended portion. I think we're all very familiar with the term of suku-suku separuh.
Exactly. I think that's inside our brain, right?
One quarter and a half.
Yes.
It's Malaysian plate concept. But it's not ideal for everyone to follow this guideline with the time constraints, with the higher price, especially. Price is a major barrier. But beyond that, for example, like that time, right? And
time factor,
time factor, the lifestyle. Where they are busy, usually is more on grab and go culture. What is easy for them to grab? what is filling, what is so convenient for them to have at that time, right? So the eating behavior changes among the people, right? They do not have a proper meal plan, proper meal intake, right? Their food choices are affected. So we can look from economic, social, as well environment factors.
Right. And actually, the environmental factors, perhaps of late, maybe just the past 5 or 6 years, have increasingly been playing a huger role, right,
yes,
when it comes to behaviors. So interestingly enough, B40 as well as lower M40 families are shown to spend anywhere between 14 to up to 19% of their incomes just on food alone, but they're priced out of the healthier options. So let's speak about food behavioral culture a little deeper. So how can culinary education hopefully close the existing gap between access and also aspiration? Because quite often what appears attractive as a food choice may not necessarily be nutritious, right?
Yes, true. So when it comes to culinary education, right, so we are trying to help bridge the gap between the aspiration and reality by equipping the people with the right knowledge, practical cooking skills. So we need to break the myth, first of all, that
what's the biggest myth for
healthy eating is not always expensive. So the truth is you can eat healthy with your minimal ingredients, with the resources that we have. So we always have a mindset that, okay, eating healthy is a luxury or pricey, and we try to forget that actually we have enough resources to make our food healthy on our plate.
Right. And when it comes to the type of education which is happening, perhaps do you think that the way in which universities with culinary institutes such as Taylor's, what role have they also been playing in sort of advocating and ensuring the message goes out there?
Okay, we are one of the leading voice in food studies and gastronomy, and we engage with a lot of community impact projects.
Right.
And we really see the real transformation among these vulnerable groups, like the low-income families, as well the B40 families. And I can share one of the projects that we have done, and it's still ongoing. That is, but this is more focused on the children with the Nourish You program. So we try to educate the parents, the teachers, how to make healthy food for their children.
Right. Okay. So when this community outreach occurs, if you wouldn't mind to perhaps walk me through what kind of numbers are you usually looking at for such programs, especially the ones which are currently still ongoing?
I mean, we engage and collaborate with industry partners.
Right.
Then we have NGOs that work closely and support our academic community collaboration. So usually it's like a intervention program where they will come to our institute, and we as an academic, we will share our knowledge. We will provide them with hands-on training, practicals, and then we will do thorough monitoring to help them. Even we have seen some of them have started their own business with the minimum resources that they have, with a small cash aid that we have provided. And now they are sustained with their lifestyle.
Exactly, because then it provides people with the resources, but also to continue on for sustainability.
For sustainability. So we continue with the monitoring.
Interesting. And now I think perhaps it's time for us to look a little deeper at the fact that Malaysia, of course, and I think anybody would say this as the most obvious thing, we're very food rich, but perhaps nutrition poor. So how do we close that gap, Dr. Salini? Are we basically unable to teach the appropriate cooking skills, or is it more a factor of nutritious food being less affordable?
Definitely, Malaysia is considered as a food paradise. You can get food anytime, anywhere. So we have like 24 hours fast foods, we have kopitiam, we have mamaks, where people like really love to spend their time to get the foods and hang out there. But again, food rich doesn't promise nutrition rich. Why? So if you really zoom into the type of food that really can get it from all this type of outlets that I have mentioned just now, it's either it's a high fat, high salty, sugary. So it creates a culture where people consume unhealthy foods more rather than nutrition-rich food.
Right, correct.
And this drive to the NCD, like hypertension, blood pressure, and all those heart disease and
diabetes.
Yes. And these are among the fastest and rising health issues. So on top of that also, just to add on, we are also double burden. It means that undernutrition, stunting among the children, obesity, it's all again because of this poor diet.
Correct, exactly. And the more interesting thing is also the fact that this is not only unique to Malaysia, but globally we are also seeing ultra-processed foods, they dominate, mostly because the cost is driven down. There's a lot of advertising that helps to promote it, and it leads to a little bit of a vicious cycle, right? So ideally speaking then, Dr. Salini, so if you were to design a Malaysian plate for, let's say, a single-parent household, perhaps a single mother, on a minimum wage today, and you had to include cost, nutrition, as well as the time factor required in, of course, preparing for a meal, what would that most likely look like?
Yeah, when we want to focus on more on single mom or working mom, so it's become a part of our daily life to prepare healthy food for the family members. At the same time, we are juggled between work and our responsibility. So what we can do within the shorter time, basically we can prepare simple meal, right? Which includes like minimum cost, but healthy. So what we can do it right now is fully utilize the local ingredients.
Right, more local
ingredients on your cooking. You plan your meal, right? Okay, for example, you can substitute meat with more to plant proteins like tempeh, tofu. You can cook this in a stew, and you can stretch to all over meals, right? So
understood.
Right. And next, zero wasting cooking.
Okay, and what would that look like for a Malaysian kitchen?
When we say zero wasted cooking, we don't waste anything, even the peels of the vegetables. You can use to make it stocks, or use these peels in your soup and make it as a broth, and to add on more flavors. And what to go more with the trend, where maybe the children preferences, leftover rice. You can add on with some shredded vegetables, eggs, and make it as a patties of rice. So you're not wasting or throwing away your leftover rice, or you can make a simple nasi goreng.
Right, exactly. So it's clearly looking at the fact that to stretch the budget, culinary innovation or creativity is actually going to be just as important, because the fact of the matter remains fruits, meats, vegetables, they currently actually are costing anywhere up to even 2 times more than starches. Right? So the challenge really is balancing for that healthy, nutritious plate. And in communities that you have actually worked on outreach projects with, how long does it take, perhaps out of curiosity, for such behavior to become a habit?
The project actually for 1 year.
Right, okay, so that's a sufficient amount of time.
So it's sufficient amount of time where we divided it into 3 phases. Phase 1 more in terms of recruiting the right participant for our program, and then second phase is more on the implementation, where we conduct trainings as well hands-on workshops for them for I think nearly 3 to 4 months. And the final phase is more in terms of the monitoring, where they have to apply the knowledge that we have shared with them.
Understood.
So it's not that, okay, once you come for the workshop with us, then that's it, the end. No, they have to practice, apply it in their daily life, and we play the role to monitor on them. We give the consultation, feedbacks, how to do improvised. And to be very happy to share that they have improved with the additional income that they can generate through our programs, community impact. So it's really real transformation. Understood.
Thank you very much, Dr. Salini, for the conversation so far. We take a short break. Don't go anywhere. We'll be right back with Niaga Spotlight. Welcome back to Niaga Spotlight, still with me, Tamina Kausji. And of course, today we are talking about the cost of eating, affordability versus nutrition with Dr. Salini Devi Rajendran, Senior Lecturer with Taylor's Culinary Institute, Taylor's University. Dr. Salini, going straight back into the conversation. So tell me a little more around your thoughts about how institutions like, of course, Taylor's Culinary are taking a more active role in influencing, looking at national food policy, because ultimately this discussion truly is about realigning systems to suit the needs of the rakyat, right?
We engage strongly with research. We do a lot of research from areas such as food system, food security, the supply chain, food studies, covering more from the gastronomy perspective as well. And we share the findings and insights of our research outcomes through research publication as well with the media for the public's knowledge. And we have impact labs, right, where these impact labs carries projects that can contribute to the community directly, like what I have shared earlier.
That's right.
And beyond that, we also strongly work with industry partners, right? For example, like how to turn food wastes into edible innovation. So we strongly work with all this innovative to reduce the food waste, to bring in new food on the plate, it's more creativities, works and so on. And to make it more realistic in our teaching, we have urban farm in our campus.
Understood, because then the students also get that hands-on perspective.
Hands-on perspective. So how this urban farm works? So it's from farm to fork. So these culinary students, they will harvest from our urban farm and they use those produce to be cooked.
Understood. So that's basically looking at how the system can actually provide for a more nutritious plate.
Yes, and apart from that, the urban farms vegetables also promote and sell to our staff and students for the daily consumption.
Oh, that's amazing. And I think it's also a nice perspective to integrate with the fact that, for example, in the UK, a parallel to look at perhaps would be chef-led advocacy by Jamie Oliver's campaigns, which actually help to push for sugar taxes and even a healthier school food. So coming into, of course, because you mentioned students and on campus, so let's look at food on campus as well as food security. And now various studies are also starting to indicate that undergraduates and students at universities around Malaysia actually suffer from anywhere between 22 to up to even 70% food insecurity. So tell us a little bit more about the type of role which universities can also play in modeling nutritious, budget-friendly food systems.
So in university, we don't just feed the students, but we also help to build and shape the food culture.
Right, yes, that's very important. So what kind of pointers do you feel have been helpful in the Taylor's experience, at least, for building that food culture?
Food culture. All right. We diversify the food options, right? So we try to have more cafes, retail outlets, which can provide healthy and nutrition type of food. Instead, giving more towards instant, ready-to-eat processed foods. So we try to have more healthy cafes, and even from our urban farm, we directly used to sell it to our own cafes, where it comes like a salad bowl and fruits and everything for our students. So we try to promote even like healthy types of food during our event.
Understood. Because ultimately, it's not only about how it affects physical health, there's also impacts on mental health, also even academic performance.
Yes.
So looking at the fact that, of course, from the private sector, universities have the resources quite often, and also the interest in active citizenry and building the future for the students. When it comes to the public sector, universities also, what may be simple sort of parameters could they go ahead with so that students from public universities also can be covered by such initiatives?
From my standpoint, I think either it's a public universities or private universities, we are working closely towards the national agenda, that is food security, food
That's
systems
right.
and everything. So we have our efforts. And when we say efforts, it should be a collective. I mean, we can't look in a very silo. It should come from different actors with the support of the government. For example, they can offer like food vouchers.
Correct.
Food vouchers for the students so that they can eat without any stigma. They're able to spend the money to buy the foods like more healthier without thinking about the price, for example.
Exactly. And there is actually a regional example that points to this. In Japan, they actually have a 100 yen student lunch model, which offers a viable template for affordable, nutritious, university-level meals. So let's shift the conversation a little wider now. Now, of course, as we mentioned earlier, Malaysia has an extremely vibrant food culture. Now, part of that food culture are also chefs, food creators, those who have a lot of influence online as well, right? So what kind of culinary professionals and influencers, what can they do to perhaps shift public perception and food trends now that, of course, it's becoming more pricier to dine outside? So it's quite likely there's going to be a bigger shift towards preparing your own meals at home.
So this is where the culinary professionals and the influencers should take step in to influence the young generation, especially, right, as well the adults, right, where they try to normalize local ingredients in, like, for example, in a live cooking shows, in preparing the recipes, demos, right, even the public events, promote more on healthy foods, all right, using the local ingredients. I think this is also one of the announced by our Prime Minister, that more encourage on local foods.
Yes, hyper-local ingredients.
Yeah, during the events, all right? So when it comes to influencers, why not they try to show in a more creative way how they can work on in a very creative way or innovative way, all right, to prepare a food with local ingredients. One of the example is like ulam wrap. All right, we know that wrap is more on Western culture, right? But we can still make it more fusion, affordable. Why not you substitute the lettuce with ulam or pagaga? So it's
which also has a host of health benefits.
Yes.
Yeah.
So it's still rich with the antioxidant and minimal cost, and you still can enjoy this wrap.
Exactly, localized flavors, but also making that more and more normalized.
More normalized. So when healthy eating become easy, it will become a daily habit, and people will normalize it.
Exactly, and every bit matters because influence continues on, particularly in the digital arena. So let's end out our conversation though, Dr. Salini, by looking a little bit deeper at the 100 ringgit universal cash allocation, which is going to be rolling out very soon by the end of this month until 31st of December. So it's unprecedented. But at the same time, let's look at how it could, on one hand, improve or also limit food affordability and nutrition equity.
It's a mixed reaction and feedback. But again, in this context, it's a very welcoming move.
A first step. Yes.
At the first step. All right, especially those who really need. So it is a small amount, but it can give a big impact, right? So if the people plan well, all right, they can actually get it groceries, sufficient groceries for this 100 ringgit, and it can relieve a short-term burden for this family. So it's all back to the how well the family members or the individual plan to utilize this in a very wisely way.
Exactly. So also it's about the fact that we perhaps can look now then on a policy level, nutrition guidance or even purchasing incentives around more nutritious options. Because that perhaps can help influence future consumer choice, right? Because I was actually referring back to the example you shared about the community outreach efforts, where there needs to also be a 3 to 4 month monitoring period to see whether the the habits around food choices stick.
Yes, true. So we can't look make a conclusion with a very short term, but a monitoring system is required to understand better about this purchasing pattern or the behavior from the people with the financial aid that been provided.
Exactly, and there's also an opportunity here to actually no need to spend any further monies around it, but all the outlets which have been earmarked for these purchases can already collect this data.
Yes.
And the data will be of value when it can be analyzed.
Yes, true.
Right. So perhaps to move out of the conversation into let's looking at a whole of government approach. Tell me a little bit more about your closing thoughts around this, when basically what we actually need is to not work in silos, but collaborations across all relevant ministries as well as our stakeholders.
Yes, so when it comes to the food security, it refers to equal access.
Right.
Equal access to everyone. They need to be affordable, and the food must be available so that each one of us can have a sufficient food for the livings. And this is aligned with the Sustainable Development Goals, SDG 3, good health and well-being. So our system, the food system dimension, need to be very systematic in order to allow people to eat, to access, right? To make it healthy eating as a choice, not a difficult one. So
the option needs to be on the plate.
On the plate. So price it right, sell it at the right place, and definitely people will make it as a habit to normalize their daily routines.
Exactly. And I think particularly important would be intervention at an early age, because also we're having data which is showing that about over 20% of Malaysian children under 5 are actually suffering stunting. And stunting, of course, once again, disproportionately impacts lower income households.
Yes.
What would you have as perhaps one last parting thought on how to manage this on an immediate basis, looking at stunting amongst children who are growing, but also the fact that children grow daily, so there's no time to waste?
Okay, so now the matter is, it's not eating less or eating more. You must know how to eat right. So make your plate balanced, moderate, and variety. With the minimal ingredients, cost efficiency, we can do a lot. So if you know how to do it, especially with the culinary skills, and there are a lot of ways for us to
access this
information. All right, YouTube's, recipe books, blogs, all right, with all those influencers, reels on social medias. I think there are ways for people to change the habit.
That's right. Dr. Salini, thank you so much for the conversation and so far. Now, this discussion is a reality check that food is never just about food, it's about policy and ultimately deeply personal. Rethinking Malaysia's food system requires not just government intervention and universal cash handouts, but data collection, re-education and advocacy from kitchen to classroom. Until we confront the structural cost of eating well, we risk baking inequality into every meal. Well, lots to chew on, and that's all we have time for today on Niaga Spotlight. We'll see you again next week with more economic analysis and insights. Here's to a productive week ahead.